Your baby's cranial helmet. Tips for putting it on and taking it off. It is important to share what you learn with others who care for your baby. Putting on the helmet. It is very important to put the helmet on correctly to help increase the chance for it to work. Some movement of the helmet is normal. However, contact your clinician if you notice helmet movement to the extent that an ear is fully covered, if redness is noted on the ear, or if the helmet is covering your baby's eyes. Putting on the helmet. Step 1. Make sure your baby is sitting upright. Depending on the baby's age, she might need help sitting. If so, ask someone to hold your baby. If you are alone, use something to support your child, like a high chair, bumbo seat, or boppy pillow. Step 2. Face your baby while holding the helmet on the edges of the opening, and open it nice and wide. Use your baby's ear opposite of the opening as a guide. Let the helmet drop down to cover the back of the neck. Make sure you can still see both ears. Step 3. Once the helmet is in place, ensure it is positioned properly before closing the strap. The helmet should be resting just above your baby's eyebrows. Step 4. Close the Velcro strap without tightening it, and make sure you can still see the gap in the opening. Taking off the helmet. To take the helmet off, open the Velcro strap and open the helmet nice and wide in an upward motion. Monitoring your baby's skin. Redness. Pay close attention to your baby's skin every time you remove the helmet. Do this especially in the first week of wearing the helmet, as your baby's skin is adapting to the device. Look at your baby's entire head and through the hair for any signs of redness. Some redness is expected. It should begin to look better after the helmet has been off for an hour. If the redness does not improve or a rash develops, leave the helmet off and call your clinician. Excessive sweating. It is normal for your baby to sweat more during the first 2 weeks of helmet wear. It is important that you continue the wearing schedule exactly as prescribed in order for the sweating to improve after 2 weeks. If your baby is sweating a lot, you may take the helmet off, dry it, and put it back on. To help with the sweating, dress your baby in less clothing to help keep her cool. You may even need to set a fan on low in your baby's room, especially if she is warm-natured. Contact your clinician to discuss any questions and concerns about your baby or the helmet. This is general information and not specific medical advice. Always consult with a doctor or healthcare provider if you have questions or concerns about the health of a child.